The BC CDC has just announced there's been a total of 17 new cases in the past week, bringing the total confirmed infections in the province to 49. I've also learned health officials have been bracing for a potential surge in measles, with school ending this week and people traveling more. Remember, we've only had a few cases here in BC, but between Alberta and Ontario, there are more than 3,000 confirmed infections. They're still trying to figure out exactly where people contracted the virus, but they believe many or all happened locally. We have a list of locations where people may have been exposed to the highly contagious measles virus on our website. The early symptoms can be mistaken for a cold, including a cough, fever, runny nose, and red eyes. By the time the rash sets in, multiple people can be exposed. Health officials are now preparing with masks and PPE to handle more potential infections as summer travel ramps up.
We have connected with our emergency department, infection prevention and control team, and the primary care providers to really be prepared for patients who may show up with fever and a rash.
Most of the time, measles can be a mild disease, but I don't recommend anyone to take the risk because there are a range of complications that can follow measles infection. So they range from like a just simple ear infection to more serious ones, such as brain inflammation that itself can cause seizure.
2 of the 3 people in Chilliwack know each other, and health officials say they've already reached out to people who are in close contact with those infected in Interior and Fraser Health. If you think you might have measles, Public Health is asking you to isolate immediately and let them know so they can test and be sure, and then have a better idea of how common the virus is. So far, all of the infections in BC have been in unvaccinated people, so they're also urging anyone who hasn't had the MMR shot to continue to consider getting immunized, which you can do at a pharmacy or community clinic. Nafisa.
Thank you, Penny.
You bet.